This video is a collection of videos showcasing what we can do with chiropractic care. In this video, we're going to discuss Bree. A lot of doctors will ask me, how did I learn my editing skills? And the truth is with time. If you'll notice the timestamp on this was done in 2016. So I've been doing videos for about 5 or 6 years now. And of course, your skill gets better as you do them. In the past, I would put the patient in front of the markers, the pink tape on the wall, so that we would have a visual image of the patient's stability. In this case, I treated Bree and then would go back and remeasure her balance. We're also going to look at the case studies of Gloria,
Berkeley,
and 3 case studies with Dr. Parisi. Let's get into our video.
Can you do it with your eyes open? Let's see if you can do it with your eyes open first. Now close your eyes. Close your hands right side. I want you to make it right this way. Please switch hands for me. Do you feel that difference?
It's looking pretty good. I haven't had it in a while, but
Let's try the left one. Head straight. Oh, wait, you look at the camera.
that's great.
Now close your eyes.
Oh, there.
Reach out the left fist. Rotating like this. I want you to feel that in sync. I want you to go as fast as you can. Ready? Faster, 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 faster. Faster, 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 faster. Keep going, keep going, keep going. There it is. Pause for a second. Try this one. Same thing like this. Faster, faster, faster. Do they feel in sync to you? Yeah. Did you see that, Jimmy? How they're...
Bend this knee, toe up. I'm going to try to straighten your leg. Do not let me. We did get it. Feel the difference? Try this side. Go. Feel that?
That's my stronger leg, though.
Relax, relax. Well, it should still hold. You have no strength in this.
My Achilles,
Yeah, this is where
the weaknesses.
your calf muscle attaches. So we're going to see if it's a... So remember how I was telling you, Jimmy, like the electrical system might not work, but muscles can also be injured. She might have an injury to this muscle.
Well, up the ankle at extreme.
And
Recently.
and this
And I
muscle.
couldn't move anything for a while. I mean, my foot was completely, I mean, it was bad. My ankle was huge. I had a boot on for 6 weeks.
Try this one again. Are you ready? Point up, other way. There you go. Go. It was a trigger point issue. Relax in this ankle. Your ears in the center of your head or more in one ear versus the other. Check this muscle out. We're going to check all your muscles. I'm going to push down towards the table. I want you to push up towards the sky. Do not let me push down. You push up. Go. Good. Try again. Go. Ready. Go. Good. And then try this side for me. Go. Good. Bree, I'm going to drop your headpiece just a little bit. Try again for me. Go. Good. And then try this one. Push up. Good. Breathe, relax. Push up. Go. Good. 3 head straight. I'm going to push in, you push out. Ready? Go. Try again. Go. Try this side for me. Go. Okay, so both your glute leads are not working. Bend. All right, I'm going to cut this video down because it's older, it's not great quality, yada yada. What I want to demonstrate here is that I performed a pinwheel exam and it was uneven from left to right. And then I did some type of therapy. In this case, we did right-sided cerebellar exercise.
All right, let's try this. You ready? You're going to try the arm. Switch. And switch.
And then I went back and rechecked the pinwheel exam. And the pinwheel sensation from left to right became more equal. That's what we want. With a lot of my videos, we'll do some type of test, we'll do some type of therapy, and we'll retest to see what the outcome is.
Bree, we're going to adjust your movement today.
Oh my gosh.
This will not hurt much. All right, you can laugh.
This is our patient Gloria. Gloria's in today for some neck pain, and she was having some bursitis in her last visit, and we adjusted her neck. She had a lot of soreness with her cervical spine, which we would expect, so she's here for a follow-up today. Gloria, push up, go. So the last time we did this test with Gloria, she failed all her tests.
I did.
And now she's holding strong. Except for that one.
Yeah.
Go. Alright, so that's a deep tendon reflex. It's failed on the left and also on the right, so it's bilateral. Push out that way. Go. Alright, we've got a glute med on the right that's inhibited. Go. And a glute med on the left. Push up for me again. Alright, we're coming back to recheck the anterior muscles because if they fail, that tells me she's got an adenosine triphosphate production problem. Are you having fatigue? Go. So she started off with no problem in the beginning, and now she has a problem. Go. All right, we got other issues to fix. In some of my videos, I'll have this happen where we're testing a patient. Initially, they test strong, and everything looks good. And then as we do continued testing, they start to go weak. And this tells us that we have some type of problem with producing the manufacturing adenosine triphosphate.
What does that mean?
That means your body's not making energy the way it's supposed to. If that's the case, which with this patient it is, it might also show some underlying form of depression or fatigue. Push up. Good. Push up. Good. Push up.
What did you do?
Go. Let's do all your muscles. Go. Good. Push out. Good. Push out. Good. Push up. Push up. Push up. Go. Go. Okay, that's better.
Both? Just one?
Same, better, worse.
Better. Feels better. God,
What would you
what
expect?
did you do?
What would you expect?
I don't know. I've had this since April.
Gloria here was considering going to see an orthopedic surgeon.
Yes. This was my last resource.
So instead of going to the chiropractor first, she went to the chiropractor last.
I mean, I actually had an appointment with the surgeon already, but I canceled it 2 months ago because I wanted to wait, see if I got better, but I didn't. Well, I thought, why not give it a shot? Okay.
Look right. Other right.
Oh, the right. Oh my god, that hurts.
I know.
Holy cow.
Now go for the low. Let the pain subside for a second.
Yes.
All right. Alright, now try lifting.
Wow. Better.
Except when they
Oh my god.
So we're going to hit the pec portion of the pec sternal, pec clavicular.
Ooh. Holy. Oh my god.
Alright, raise that, see how that feels.
Good.
Different, same, better?
Different, better.
Actually, move your neck around, see how it feels.
Feels good. Feels lighter.
Right.
Relax.
Good. Let's stand up.
Calm.
Well, I hope so.
Oh, one thing I forgot to tell you. When I left last time, I felt so good up here.
Huh?
Because when I came here, it felt like I had.
Constricted.
Yeah. And then yesterday, I noticed that I was able to actually, just have the better posture. Like I could get more air.
This is our second visit.
Yeah. Anyways, okay.
Drop.
Drop.
Your arms, that is.
Oh. Okay.
Got it, right?
All the way down.
Let's get you to go for a walk and see how you feel. Feel better?
Better. Lighter.
Yeah, I hope so.
I can breathe better.
How about your arms when they go up?
Wait, I can try my yoga pose. It feels so good. I'm not kidding. I haven't been able to do this for like 4 months.
Gloria, thank you for giving me the opportunity to treat you in the office.
Thank you so much for helping me.
Appreciate it.
I appreciate it more. Honestly.
This is my patient Berkeley. Berkeley suffering from neck pain and shoulder discomfort. I examined Berkeley, made the adjustment, then I adjusted her upper thoracic, examined her low back, gave her some trigger point work, adjusted her L5 to the right, her sacrum to the left, did some trigger point work on her shoulder muscles and her scalene, gave her upper thoracic distraction. This is that case.
So my neck's been really tight lately, just kind of the same thing that like happens, where just this side feels like it has less mobility than the left side, and my right like rib where like my scapula is always just feels a little bit like tighter or more restricted.
Lay your shoes off, see what you got. So what I'm doing here is I'm testing Berkeley in these different reflex testing to see if her muscles are holding. So whether I'm tapping the knee or stroking the bottom of the foot, or testing her hip muscles and then having her turn her head, retesting the hip muscles, we're trying to find out what area in her neck is out of place. And if I can identify that area properly and make that one single adjustment, the hope is that we can correct all those weaknesses, both in her lats and in her lower extremities. Here I'm doing some simple stretching on Berkeley's neck after adjustment to make certain that her tendons and ligaments are loose, and then I adjust her thoracic spine. Just relax, I got you. So here what I'm doing is I'm examining Berkeley's low back and trying to find the very specific area of dysfunction. And when I find that area of dysfunction, her leg should go weak, just like that. So that told me that it was her sacrum, and the sacrum needs to be adjusted to the left side of the table. So here we did her L5 to the right, and here we did her sacrum to the left.
It's getting up right there. When I had like pressure on this part, I can like feel that in my neck. When I had like pressure on my arm getting up. Just, I don't know why this side is so bothersome. Like I'm forward, I feel more tension here and going to like here than I feel like anything on the left side.
Alright, do this for me. Put pressure on that right fist again, see if it hurts your neck.
I mean, it wouldn't just like say hurt, it just like
You feel
I
it.
feel it, yeah.
How about when you put pressure on the left hand?
I don't really feel anything there.
What Berkeley noticed when she pushed off with her right hand is she had pain refer up into her neck. So that told me she had some kind of dysfunction with her right pectoralis muscles. So we did trigger point work in the right pectoralis muscles.
Don't punch me.
I'm punching you, sorry.
I put her face down again and had her put pressure again with that right hand. And she actually felt a little weaker, so we had to go for a walk to get her system fired up and see what that would do.
Hey guys, just give me a quick moment.
No problem.
How you doing? I'm glad to see you.
So letting patients go for a walk fires up their proprioceptive pathways and helps reset and resensitize muscles after treatment.
Yeah. No, it feels better. It's like
Well, there's two things. You have a bending on the neck is one, and pushing with the arm is the other.
pushing is fine.
Okay.
The second that my head went a little bit that way, I just like felt like a pinch. I just feel like I'm being like finicky.
You are, but so.
Like when you rub that, I feel that in my back.
Let's start from the top, on your stomach, push up, let's see how you feel.
I just feel like I have like much more freer range of motion.
So freer on the left.
Correct. And the right, like it's not like it like physically gets cut. It's just like there are moments where I like feel my neck.
Why don't you stand for me?
This is an upper thoracic distraction, and what you'll notice with a lot of doctors is they'll place both hands behind the neck and they'll do a lift. Now in wrestling, this move is illegal. It's called the full Nelson, and it puts too much pressure on the cervical spine. So when you'll see me perform it, I'll separate my hands as to take pressure off the patient's neck.
Got ya.
I felt something.
Yeah. Now try your whole head.
The whole thing. It's still like
Is it better than what you can?
it's better. Yeah, it's definitely better.
Like the hair. Okay, wonderful. Give me, let's see how that works, the
Okay.
residual, and then I'll see you in a week or so. This is a teaching video dedicated to my friend and colleague, Dr. Orit. While Dr. Orit and myself were going over adjustments of the cervical spine, we also examined Berkeley. Then Dr. Parisi came in. Come on back, Doc. I'm going to treat Matt first alone, and then I'll treat Becky. Doc.
Hi.
This is my patient, Dr. Parisi. I examined her. We tested some reflexes, adjusted her lower cervical spine, adjusted her thoracics, gave her a massage, adjusted her ilium. As with all chiropractors, when we get together, we go over techniques and styles of adjustment, and we demonstrate them to one another, and then we perform them on one another. This is that case.
My thoracics are super locked up.
On your back. I'm running through the whole testing protocol just to show the doc, okay? Check anterior, posterior, anterior, posterior. In this video, what I'm going to do is I'm going to test all of the muscles in red. With all my patients, when we do our muscle test, I do a particular pattern. And the basic pattern is we're going to test the anterior muscles of the lower and upper torso and the posterior muscles of the lower and upper torso. And it's kind of a screening tool to tell us what the general facilitatory state of the body is. Then I'm going to perform a flexor withdrawal reflex, a deep tendon reflex, and I will do a flexor withdrawal reflex of the hand. Then we're going to check the hip flexors, and then we're going to check the hip flexors with head turn. I'm going to break this entire session down piece by piece. The general terms strong and weak are terms we use to describe muscle function. I'm going to use the more accurate terms, which are facilitation and inhibition. So facilitation means the muscle's strong, inhibition means the muscle's weak. Push out. So they're not working at all. We're going to check her upper anterior. Go. That one's good. Boy, don't pull. That one's good. Pull towards your hip. Try again. Go. So that's not working. Just towards your hip. So with Dr. Parisi, what we notice is that her anterior muscles and her lower extremity are inhibited. Her posterior muscles and her lower extremity are inhibited. Her anterior muscles on her upper torso are facilitated. Her right latissimus dorsi is inhibited. Her left latissimus dorsi is facilitated. So this is a little video explaining the flexor withdrawal reflex. It demonstrates for our purposes what the flexor withdrawal reflex does and how we can test one limb and then go check other muscles.
The spinal cord receives and processes information from the body. The spinal cord is also the final common pathway for most voluntary and involuntary reflexive movements. In this animation, we'll examine the spinal pathways involved in the withdrawal of a limb from a painful stimulus.
Or a thumb.
Sensory axons enter the spinal cord through the dorsal roots, where they synapse upon interneurons, which in turn project to the motor neurons and send their axons out the ventral root to innervate muscles. Some motor neurons innervate flexor muscles, while others innervate the extensor muscles. With the withdrawal of one limb, the weight shifts to the contralateral limb. Interneurons also connect to motor neurons on the opposite side, so that the muscles in the other limb can adjust to the shift in weight distribution. Flexion of the stimulated limb is therefore accompanied by an opposite reaction in the contralateral limb. That is, the extensor muscles are excited, while flexor muscles are inhibited.
Okay, so we're not going to use a tack. We're simply going to use our thumb. And notice that when I stroke the bottom of Dr. Precy's foot, how she'll jump like that. And you'll see that is very common with most of our patients. This is actually one of the tests that most of our patients hate because it does just startle them. But it sends a signal into the nervous system, and then we can start testing muscles to see if the pathways are normal and intact. This is a deep tendon reflex. You know it as this. I'm simply doing it with my hand and a muscle test in the supine position versus the seated position with the reflex hammer. So the doctor's responses here are abnormal. She should have facilitation or strength with this muscle test. Palmar reflex, just a demonstration. Push towards me. So it should stay strong, and it does not. Push towards me. And that one does stay strong. So leave this for me for a second. Don't let me pull. Great. Don't let me pull. Good. So they should be strong. Now we're going to have her turn her head. So doctor, turn her head right. With turning the head to the right, theoretically we activate the tonic neck reflexes, which cause facilitation of the left hip flexors. So in this example, when the doc turns her head right, it should facilitate the left hip flexors, and it does. This test is normal. But watch what happens when we turn her head to the left and test her right hip flexors. This is a little video on asymmetrical tonic neck reflexes that we're using in combination with muscle testing to evaluate patients.
The asymmetrical tonic neck reflex is tested by carefully turning the infant's head to one side, which typically results in a tonic extension of the extremities on the facial side and a bending in the contralateral extremities.
So to repeat, with Dr. Precy's left head turn, she should have facilitation of the right hip flexors, and she does not. This is the asymmetrical tonic neck reflexes that we're utilizing with muscle testing to evaluate where there's dysfunction in the system. So head straight again, just to confirm something. Don't let me pull. So a simple side note here, with the patient's head in the neutral position, all muscles should be strong. Now that's unless we introduce an inhibitory reflex. So here I stimulated the C1, C2 spinal joint and went back and retested Dr. Precy, and it caused the facilitation of a lot of her muscles. It did not cause facilitation of the left hip or of the right latissimus dorsi. So looking at an overview, we went from this to this. So it corrected a lot of muscle groups, but not all of them. We're looking for the one that turns everything on. I went back and mobilized the C7 T1 area. Push up, doc, go. So it fixes that one, push up. Fixes that one, push out. Fixes that one, push out. Fixes that one. And it caused facilitation of the left glute and the right lat. So just to reiterate, we went from this to this with that C7 T1. So once again, we started out the initial exam with this pattern. We stimulated C1, got this pattern. Then we stimulated the C7 T1 junction. We got this pattern. That's the area that I'm going to adjust. Doc, you want to come watch? So we're going to grab the SCM. Turn our head for a tissue slide. Come here on the... Yeah. You're trying to support all those other segments because you're trying to get that one segment. You're trying to avoid having C5 or C4
One isolated.
to the degree you can. Yeah.
A little sweaty.
No. But you're also a little chilly, so. This is me going back at the end of treatment and reassessing all the muscles that initially tested as inhibited and making certain that they are facilitated and working properly.
So there's no like lumbar spine involvement that you're...
With her, we could, she's got,
Lumbarization or sacralization or whatever.
so with her, I mean, I have adjusted her L5 and her sacrals, but I like to be really cautious with
Yeah.
her.
Oh, I totally get it.
What I'm doing in this exam is the gallant reflex, and what should happen is when I stroke the ipsilateral side, it should cause inhibition of the hamstring on that side. So if I stroke the left sacral area, it should inhibit the left hamstring. This is a little video demonstrating the primitive gallant reflex in a newborn with the stroke on the ipsilateral side. You'll see the child flex towards that side. This is my preceptor doctor, Dr. Michael Allen, who educated me 16 years ago at the making of this video. Dr. Allen demonstrates the gallant reflex
using the hamstrings as an indicator. Hold strong, don't let me push. This is a functionally facilitated hamstring on each side, stroking the lumbar spine just right next to the spine, ipsilateral to the chest. The hamstring should be functionally inhibited.
In summing up, what we found with Dr. Parisi is that when I stroked the left side of her lumbar sacral area and tested her left hamstring, it did not inhibit. This is abnormal. I found that the doc's ilium was out. After the adjustment, I went back, rechecked the gallant reflex, and found that it had normalized. So in summing up the previous sections of this video, what I want to demonstrate clearly is that we can use muscle testing in combination with the primitive reflexes. We need to know normal from abnormal responses prior to doing our muscle testing. Then we can check for the reflexes to see if they're normal. If they're abnormal, we're going to find some area of dysfunction, correct the area of dysfunction, and then go back and recheck the reflex. The reason this is important is because it gives the proper information into the human nervous system. It allows the brain to take in proper proprioceptive signals. With those signals, the brain can then send out signals to the body and allow the coordination and timing to be accurate so that a patient can experience life to their fullest. This is the thoracolumbar junction, and in my opinion, it's the most difficult adjustment for a patient to receive. It's very tough on the patient because it feels as if their wind is being knocked out of them. But if it's out of place, it'll cause a lot of back discomfort and mid-back discomfort in the patient's movements. Usually come up on the skin. It depends on, what it is. The thing. You just come here and TL. And you hit.
Friend does it like that.
Yeah, however you can get it. So it's this is why I like to do my massage first. So you're going to slip on this. Get the leverage that you can on the patient. It's the worst adjustment you'll ever do to a patient.
Oh my god.
Hi everyone, this is Dr. Mark Alge, and this is a case study of Dr. Shannon Parisi. Shannon had injured herself doing some Pilates exercises, and she came in with some hip and low back pain. So we did a range of motion exam on her. Then we performed some muscle testing. We did trigger point work on her psoas, her adductors, her hamstrings, her quadratus lumborum. Then we adjusted her sacrum to the left, her L5 to the right. We performed a distraction, and then we adjusted her C1 on the left. After going back and rechecking her range of motion, it was greatly improved. This is that case study. Where do you hurt?
Definitely feel it in my SI, but the psoas is definitely involved, and maybe like QL.
Can you bend over and touch your toes?
No. Hurt myself.
This is what happens when you do too much Pilates.
No, I didn't do enough, and then went back. Really tender, like inside, right here.
You ready?
Yeah.
Can you even do this? Push up.
Not on the other side.
Go. Push out for me. Okay, so we have no lower body strength. No strength on the right lat. Go. All right. So we've got lower body weakness, posterior weakness on the upper torso.
Oh, it's just the worst one, isn't it?
Whenever we do this to each other, we think we give this to our patient.
I know.
So this is one of the interesting things. We just did some trigger point work on one muscle, and it did cause other muscles to facilitate. I'm not apologizing in advance. Just push up for me. Go. Up, 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 up. Now, how about this side? Up, 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 up. Okay, that one's good. Okay, that's much better. We're not done, but we're going to put you on your tummy. Sorry, Doc. I'm going to do this real gentle like. So we're going to apply as much pressure as she can take, and I'll just feel her muscles tense up.
Ow, ow, ow.
Or she might tell me that it hurts.
Or kick you.
Or kick me. So the other muscles we're going to look at is the quadratus laborum.
Ow, 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 ow.
And then we'll go look at her low back. So we're just going to see what a little bit of trigger point work and massage can do for her before we get into any osseous adjusting. Same, better, worse?
Walking feels good. It feels like it's pulling in it.
Okay. She also has some hypertonicity in her left side.
Probably won't want my face in the...
Probably the best part. So we're going to do some trigger point on her inner quadratus lumborum.
Ah. Eek. Eek. Ah.
So now we're doing the right side. We're actually doing the right side even though it's not tight. So we actually want to increase its ability to facilitate and see if it can counterbalance the left side, which has too much hypertonicity in it. So now we're going to check the doc's hamstring muscles, and we're going to look for normal patterns versus abnormal patterns. Doc, we're going to try this one. Pull this foot to your back. Don't let me pull. Okay. So that should be strong. It's not. We're going to check the other hamstring, and it should be strong, and it is. We're going to challenge the sacrum to the left side of the table. Don't let me pull. That doesn't turn it on. We're going to push the sacrum in the other direction. That actually makes it really strong. We're going to double check by pushing in that direction just to be safe. Good.
It's better.
See if you can bend. All right, we're going to do your L5 in the other direction.
I don't know if I can.
Doc, on this side, face me. If it feels uncomfortable, you let me know.
It's bad. Real bad. This hurts. Like there's a big strain.
Here.
It actually feels like it's pinching right here.
Let's do the setup and you tell me if you think you can handle
Okay.
it. Just the setup, okay?
Good. Didn't do that. Walk again.
Just bend. It's not great, it's a little better. Doc, we're going to give you a lift. Drop your arms. Come with me. Drop the shoulder.
Oof.
Now bend.
That feels better. It's obviously still, like the muscle is still there, but it's feeling better.
Let's do 3 more things. First thing's on your back, face up. I want to check some reflexes. Can we try this test? Push up.
It feels also compressed. Ooh! What is that?
It's your insertion for your...
That is a hot spot.
I think you injured your quad too. Real slow, Doc. Just see if you can... Up, 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 up. No.
Which
stay
is
low.
my lumbar.
Yeah.
So.
Okay. Let's check a few more things and turn your head to the right. Push out with your leg. Good. Keep your leg head there. Push out. Good. Those are normal. Head the other way. Push out. Okay. Try again. Don't give up. Go. So right now we're going to do some mobilization of the doc's C1 without doing any osseous adjusting. We're going to see what impact that has on her lower body strength. We saw that she got better range of motion with that mid-thoracic adjustment. So we know that an injury in the body sometimes is not one specific thing. It can be a combination of factors. Push out. There it is. Push out. Perfect. That might be what we needed. Now we're going to go see.
Cervical guys were right.
They were.
That's better. Yeah, much better.
So this is a good example of when a patient has multiple problems. The doc had her neck was out, her thoracic was out, her lumbar was out, and her sacrum were out. And all those areas being out, plus she had an injured hamstring, adductors, and some other muscles in her low back. And so the combination of those factors were causing pain. After that last C1 adjustment, she has more fluidity of movement, so that's great. Thanks, Doc.
Thank you.
What are you doing for you, Doc?
You did de-stress. Have I come to the right place? The stress, I'm spinning stress mode.
This is my friend and colleague, Dr. Parisi, and Doc's been in my world for a couple of years. Right before coming to the office for this visit, she went to the beach. And thank you for that, Doctor.
Got sand everywhere, yeah.
This is you back 2019. Look how young you were.
19. Ooh.
One of my favorite videos of your facial expressions.
It's a good pain face.
I love it.
Oh man, it gets even better.
Yeah. I love your facial expressions.
And another one.
This is one with Dr. Orit. We're going over chiropractic and
People was red.
yeah, and look how the room's changed so much.
Yeah.
And here we're going over your teal junction and our cervical spine. That's 3 years ago. Oh, yeah.
3? No, 2.5.
Still long enough. Dog years, that's a long time.
This was just. I really use my hands a lot when I talk.
Are those things still bugging you?
That's kind of my chronic, just from birth. My fusion down at L5. That's one.
I think what happened here, I don't recall if I adjusted both sides of your TMJ or only the left side. Because the thing what happened was your muscles weren't inhibiting. Here I gap your right. They're still not inhibiting. And normally this is converse of what I normally do. But here when I gap that left, everything goes weak. There you go. And normally I would not adjust that side. Normally I'd adjust the right side. I can't remember if I adjusted both sides. Do you remember?
I think we did it on this visit, and then the next time it was only one.
5, 4, 3, 2, 1.
Do you think it's from clenching?
Could be you're stressed out. Who's going to treat you when you move?
I don't know. Time will tell.
So the doc's moving away, and hopefully she can find a good chiropractor where she goes to. You don't like watching yourself in video?
No, I mean, this is okay. There's no audio. It's more the sound of my voice.
Nobody likes themselves
I know.
on video.
I think a lot of my stress comes from posture and my misalignment's posture and not breathing correctly. I'll get caught up in fight or flight.
Close, open, open, doc, open, open, close, and a little push. See, so here we did your left TMJ. Base. You can stay right there. Doc, hands behind your neck.
Look at that angle.
Yeah, I've been using the pad to give it extra.
Do you know who
push.
I remind myself of
Who?
lately?
Who?
I think with my natural hair is
Wonder Woman.
No, not at all. Quite the opposite. Have you seen the original Charlie or Willy Wonka and the Chocolate Factory?
The kid.
The girl that wants the golden egg. The really bratty rich one that wants the golden
That's
egg.
funny. I just watched it maybe 6 months ago.
Yeah. The dialogue in that is amazing.
What's interesting is Snowpiercer.
Hmm?
I'll show it to you afterwards. Snowpiercer is another movie that they think comes after that.
Never knew about this. What do you mean comes after that?
Yeah, well, I'll show you. I'll show you. It's a Snowpiercer. It's a really they don't look anything alike, but they seem a lot alike.
This is me attempting the what's it called?
Coupled.
Couple. So you go like this.
Yep. Just keep the head basically in the neutral position without that thumb.
Without the thumb.
Okay, so go like that. Yep. And then push on the bottom up, right? There you go. Like that. It's always easier when you get your head. Yep. Go for it.
Little guy.
You're powerful here, though.
I know, but look at my form. I could. This is why I hurt my back. I need to keep my back. The table's too tall for me.
You have pretty good control.
I've never really seen myself adjust. That's pretty cool.
Oh, then you're gonna like this video, because this is just the first part. See that? You got that long labor kick in?
Yeah.
Look at you.
I look so professional. What year did I graduate? How many years? I haven't calculated that in a while. What year did you graduate?
2002.
That was 2008.
It's been a long time.
Well, yours is coming up on what then? 20 years?
Now here's your current one.
Push up.
This was last week.
And I was in much better shape than
But here your muscles aren't fired up. Now here's your
Push up.
current one. This was last week.
and I was in much better shape than
But here your muscles aren't fired up.
Well, I can tell right now you're stressed. Push up.
Really?
How's the beach? Yeah, push out for me.
Good.
Try to push out. Yeah, you're not holding.
I just,
Did you get that number of that patient that wanted you? Did I send that to you?
I don't know.
I sent it, your number to her.
For what?
Chiropractic.
For limited time only.
Well,
I wonder what I'm talking about.
You're talking about
My psoas, probably.
yeah, psoas and headaches and pain. So we're gonna see if mobilization, that C1 and trigger point, fires up your legs.
I did a yoga this morning. It was like way less about stretching and more about like activating your muscles while stretching, and it helped a lot.
You know, today we're gonna check your occiput, not just your C1, but your occiput itself. Because you keep seeming to have the same issue.
Yes. Hands. Now I want to watch your other videos and watch other people's hands. Do they do it too?
A lot of people talk with their hands. I talk with my hands, but I'm also Italian.
little push.
Here after that, I'm checking your hands to see if you got warm, which you did.
Sweating.
Okay, push up. That's what I meant. Go. Good. Push out. Good. Push out. Well, I just got.
Thanks for that stand, doctor.
Sorry. I'll clean your
Don't
off.
worry. Don't worry.
You actually told me to clean the office. That's what you said.
I did. You said don't worry about it.
Yeah, not a big deal. So that left hamstring's weak. I'm pulled on your sacrum, which fired up that hamstring, and that's why I'm going to adjust it that way. To double check, I'll push in the other direction, and it stays inhibited. So it's interesting because your L5 didn't show positive for an adjustment.
These shorts have got to go.
Why?
We're old. It's time to upgrade. Oh, thank God. Took me a while to turn.
You liked the ilium adjustment?
That worked really well. I've just been working out again, and I think that if I activate my glute or my psoas too much, it sets stuff off. Oh, I really needed that one. So it's like that weird where you're getting stable again.
Is it hurting on you right now?
I'm just really sore. Like my obliques, my like middle abs, glutes.
Well, what we're going to do is we'll check your bilateral psoas, see if it's an occiput issue. And look at that.
Pilates.
Almost smooth. Super smooth.
Oh yeah, the walking pound.
Mimics as if you're walking.
Oh.
Push up. Check to see if you're.
At least you can't see my face.
Face is the best part, Doc.
You know I hate this.
I remember telling you that I wanted to hit you.
Yeah, right. There's your hand.
Bend his knee. Up. Okay, now we'll go check your balance. How's that?
We did it better.
Yeah.
Better.
Look at that belly. You can see it.
Eddie just had lunch.
4 lunches.
Are you doing plant-based or you're not?
I'm going plant-based, yeah. 100%.
There we go.
Whew.
That's it. Me and this headpiece. It's face down. How do I load this freaking thing?
Push the bar.
I can manipulate the bones of the body, but not that hip.
You know why I've been thinking about that? It's because your table is a pull.
Yeah.
You don't think of a push.
Look how bad my bending part. This is good information for me. Look at that rounding of my back. It's not good, people. How's your demon calves? It's not how you bend forward correctly.
It's also
This is what not to do.
It's also an awkward position in a
But
way.
I need to watch yours next time because, like, I should be hinging more, using my glutes and hammies.
Well, this is why you bring the table up.
Payback.
Yeah, you know how to hit him, right? I'll give you that.
I don't do a lot of thinking when I adjust, like you. I'm more of a...
You're a feeler. I'm a thinker.
Feeler,
Those are different styles.
Rested it for like months. Like put it in a sling. Already went.
I gave you the triple move. I should slow it down for...
Or even sped up would be funny. Boom, boom, boom.
Whew, that was great.
That's pretty forceful.
Yeah, you're tough. I mean, you're a tough little one.
De-Stress Chiropractic and Dr. Algie would like to publicly thank Dr. Parisi for approving this video, her chiropractic adjustments, and her trust in our services. Thank you, Doctor. Good journey in your future.
Thank you so much.
All right, let's get you treated.